Welcome to Heart Failure Unfiltered. My name is Nick Hartshorne-Evans, and I'm the founder and CEO of the Pumping Marvellous Foundation, the UK's heart failure charity. Today, we'll be discussing our Beat Heart Health events. Are we seeing what we are thinking? Increasing prevalence of heart failure-related risks. A podcast about heart failure and why the simplest ideas often save the most lives. This podcast asks one question over and over again. Are we seeing an increasing prevalence of heart failure-related risks? Because if we don't understand the increasing prevalence of heart failure and its imminent failure, then... Good afternoon. We are at the Liverpool Podcast Studios this afternoon. And with me today is...
Hi, I'm Fazia Ahmed, heart failure cardiologist from Manchester.
Hi, I'm Rajiv Sankanaran. I'm a heart failure cardiologist from Liverpool.
Hi, I'm Claire Taylor. I'm a GP in the NHS and Professor of General Practice at the University of Birmingham.
Great. Experts in the room. So here we go. First question. So for starters, when you think about the people coming through our Beat Heart Health events, and these are mass events where we offer heart health checks, does anything feel different compared to a few years ago? Are we noticing more often at our Beat Heart Health events that there's a change maybe to 10 years ago where it is today?
Yeah, I think I'll start. I mean, the first thing that we were taken by surprise by is the long queues. So people automatically wanted to get to these events. And which, again, it goes against what we've experienced in healthcare settings, isn't it? To an extent where people can't attend or don't want to attend due to the inherent anxiety and apprehension about tests and diagnosis.
And that really exists, doesn't it?
Yeah. And this, I think it almost opened it out to the public. I took it out in the community in settings which were accessible. So I think, that's the first thing, the sheer droves, of people coming to these testing events.
Do you think COVID was a shock to the population in terms of the psyche of going to?
Yeah, I think COVID, what it did was obviously there was a period of time where people did not have access, to tests. We said we reserve things for emergencies, for people who absolutely needed it. There was this fear of spreading the bug and things like that. So I think there were people who were deprived of the need for testing. There were delays in diagnosis introduced. And the beat testing events almost help play catch up, as it were, to an extent. So, yeah.
And Claire, are we seeing certain risk factors that are recurring at these events?
Yeah, so I think the real value and power of these events is that we're going out into communities and breaking down those barriers. Patients and families don't need to come through the doors of a healthcare setting to get their heart health checked. So they can go to their local football ground, cricket ground, mosque. And when they walk through the door, it's a place where they feel at home, that they feel comfortable. And I think that's partly what drives people being willing to go and wanting to go. And then they see, the really nice team from Pumping Marvellous and
the local healthcare teams who are absolutely invested.
Yeah, the local NHS healthcare, who are there qualified to do these measures, and they can have their heart rhythm checked through a little simpler live core. They can have their blood pressure checked, and we ask them about beat symptoms. So are you breathless, exhausted, ankle swelling? And if they're beat symptom positive, they can have a point of care NT-proBNP blood test done there and then. And somebody will explain what the result is, and then they can be fed into the local healthcare system. And as you say, that partnership with the local NHS is really key to these events.
I mean, that's been amazing. The third sector, so charities, local charities have been involved, local sort of social communities, the NHS, and even from a senior level, there's buy-in for this.
I think that's the key to make these things sustainable, because what you don't want is just to pop up as a one-off and find people with things and then have nowhere to send them.
Yeah.
So we're finding, about 2% of people who've been to the events have been found to have a new diagnosis of atrial fibrillation. We've found a lot of uncontrolled blood pressure. And these are really key factors in preventing people developing heart failure in the future. So if we can control blood pressure early, it prevents problems in the longer term, heart attack, stroke, and ultimately developing heart failure. So I think it's a really powerful way of delivering that prevention agenda that we all want to see.
I see
prevent
Fozzie's
these
fingers
things.
gone up. Yeah. Go on.
Because I keep being told I need to put my hand up every time.
I was going to ask you a question of why this was really important, but Claire's just absolutely answered that. So
I love exactly what you said.
Go on.
You just, whilst you're talking, you've got me thinking that we take our cars every year for an MOT. When we're children, we take our kids when they're young to make sure they're meeting their milestones. And then as adults, we just kind of hope that things will be okay. But hope's not a strategy. We need to, check our blood pressure, assess our symptoms. And these events really do allow people to have access without having to go through a medical professional to be tested for heart failure. And I think it's a radical shift in the way that we deliver care for people in the community. And I see it as a public health issue. I find it's great that Pumping Marvellous are doing this, but I do think that the NHS need to make it easier for you, and we need to roll this out without friction, without barriers. We need to be more supportive. There are some areas in the country where this is a recurring thing and it happens all the time. And that patients are able to access these events on a regular basis. And other areas where they don't have the same take-up, and it creates inequalities in access to healthcare.
And you know what?
I love these events. I travelled to Wales to come to
No, I know you
event.
did. I know, to Wrexham. I wonder why.
I think the other, I was just about to add to that, the inequalities. So a lot of these testing events were in areas of high deprivation, so socioeconomic deprivation. And to
Actually,
an extent,
from Liverpool 8, we were in Liverpool 8, weren't we, a couple of last year?
And the analysis we did was quite eye-opening to an extent, but we know all of these gaps already, the inequalities. And it works two ways. So the inequalities, so people in these areas, they don't have the same access to primary care and the healthcare. So all your research, the King's Fund, the Fairness Foundation, all that is shown. They don't have access to primary care appointments in a timely fashion. And what these events help to do is to bridge that gap. And what was also revealing is that the data we found, the incidence of poorly controlled blood pressure, the new diagnosis of heart failure, atrial fibrillation, that was a lot higher in areas of high deprivation as well. So that adds to the value of these testing events everywhere, but particularly in these areas with high deprivation.
Yeah, and that's where the disease sits, isn't it? They're more likely to be affected by cardiovascular disease, by heart conditions. So it's incumbent, it's mission critical that we go out to these communities.
Do we need to develop how we interact with the whole population, not just the average?
Yeah, I mean, it's...
Do you understand what I mean by that question?
Yeah, so it's about, to an extent, some of the conditions we found, like poor control of blood pressure, for example, people are not necessarily aware of the importance of conditions like that.
Silent killer.
Blood pressure. Exactly. So the so-called silent killer, and when people get unwell with heart failure or heart attacks or strokes, it's far often, I would say, not too late, but they've experienced the worst effect of having that condition. So if these can be picked up a little bit earlier, so it's about popularizing and spreading the awareness of these things, but also emphasizing the simplicity, because it took, for these events to be conducted successfully, it was a very team-based, so obviously Pumping Marvellous, contacted everybody, but it was local councils, departments of public health, volunteers, third sector, clinicians from primary care, secondary care. So it's something that can be not just achieved, but it can be replicated, it can sustain, it can scale up. So it's demonstrating the art of the possible.
100%. It becomes a successful formula that you can replicate time and again with consistent results and consistent outcomes. And then that's how your public health messaging comes through.
Yeah, I mean, in 2026, we've got 20 events. And I'll just say that I think it's really important that we needed an enabler. And thank you very much to Medtronic for providing their third year's worth of funding, because these things don't just happen in thin air. There's a lot of organisations, so thanks to Medtronic for believing in what we're trying to achieve. And I think that's really important, because it's not just, it's not just third sector, it's not just the NHS or public health or local councils, whatever. It's a whole system. And, life science companies, not pharma or medtech, but life science companies in general are invested in helping as well. So, I'd just like to say, thanks a lot. And, this podcast probably couldn't have happened without that Pump Prime. Interesting though, but are people from the events that you guys have been involved in, are people coming with concerns, or are they discovering risks that they didn't expect? Sorry.
Yeah. I mean, I think these events are really interesting way to deliver these prevention and diagnosis activities at the same time. And as you've said, they're a real partnership with local NHS, with communities, but also with industry, with academia, and primary and secondary care clinicians. So they create this event that brings everybody into the same room, often for the first time. You might have worked with your cardiologist at the rate for years, but not actually met them in person. So I think that's the real power of them. And yes, I think there are reasons why people come through the door. And I think that varies. So some people do come because they are a bit worried. So they might have a family history of a heart problem, or they might be worried that they'll develop a heart problem in the future. But I think having these at community venues really does allow people to attend whatever their reason for coming. So we did the event at Birmingham City Football Club, which is in a very deprived part of Birmingham. And people are used to going to St Andrews to watch the football. You know, tens of thousands of people go every weekend. And so for them to pop in and have their blood pressure checked and have their heart rhythm checked was actually not a big deal. They could just come in at any time. The events run all day. And so I think that's the way that we are going to address these health inequalities, because going out into these communities, to places where they feel comfortable, where they feel safe, where there's other people there from that same community, including people that can speak the language, which was an issue. You know, when we did the event at Birmingham, we had a mom and daughter come, and the daughter was, you know, interpreting for the mom, and, you know, it was on a Sunday morning, so the daughter was at home. She just came along with her. And so we need to think about all those sort of things if we're genuinely going to reach out to these underserved communities, I think.
And I think the innovative aspect was, the mass appeal, using the mass appeal of sport, football. So when we had the event in Everton, people were traveling from Wales. And again, men are historically averse to going for these testing events proactively. Usually it's their spouses who drag them to these events. But we had a lot more men attending these events. Maybe it's the mass appeal of football. But whatever works, using a sort of multi-pronged, sort of innovative, it's time we change how we've delivered healthcare. It's about that. But also I think having a team-based approach. So I think at least one or two people mentioned that they were heartened to see a lot of people there. You know, so it goes back to the "you'll never walk alone." You know, I think
to get that in, didn't you?
That's a different football club.
It's about time. Yeah, but having the team-based approach, so it's lifestyle as well. So
was that
smoking
at Everton
cessation.
when they said that?
Might have been, yes. No, but simple things we take for granted: smoking cessation, weight loss, and all that. So we have flyers, leaflets. There are people, volunteers who talk about these things. So it's not about finding conditions; it's also about the preventative element, which these events introduce.
It's helping putting the priority on things that are important that maybe people don't understand or don't see. Without any shadow of a doubt, the largest event we did was just we put the maths around this. So just under 950 people at Stoke-on-Trent. I mean, at the football club, Stoke City.
Just one day, isn't it?
One day. How many GPs and nurses would you need to process that in a day? And what I saw was, apart from the police saying that we had to close the event because the A500, I think it was getting blocked because of the amount of people. And we did a video with people stretching all the way around the stadium, and it was phenomenal. And do you know what? We got it all done by 5 o'clock, everybody. And it was an absolute multidisciplinary team. It was a team event. But what I saw, which was really interesting, was the reasons why people hadn't or were coming because of COVID, or they hadn't seen the GP or whatever. And it was the accessibility to that. But when they got there, they saw, Bob saw his mate Jim, who he maybe saw at the local darts club a couple of weeks ago, and they sat down and talked. And it became very much of a, it was a tribal thing.
And one of these,
because they both supported Stoke City. And we got that at Port Vale. I mean, one of the comments was, Port Vale must be in the Champions League, queuing for tickets, because the tickets, the queues were just so long. And people were willing to wait. Unfortunately, we just couldn't process. We're willing to wait 2 to 3 hours. Just what we would say are rudimentary checks.
Yeah.
But we were finding it hypertension and finding heart failure or suspected heart failure in its droves.
And it was sort of putting people at ease in these settings as well. The one in Northern Ireland, the one we took the ferry to, it was a community center, a library kind of based place. They had a choir going, at some stage people started singing.
It was a cafe and yoga center,
Yeah, exactly. So it's bringing people to places which they probably attend regularly. They go there on a daily basis, doing the checks, making sure, giving them that reassurance. Because a lot of tests, you can reassure people that they don't have any heart problems as well. So there's that value to that. Yeah.
And I think what you really highlight is the fact that it's this multi-agency approach, that when you have these events that are so well attended, it's been everyone's had skin in the game. GPs have sent out messages, and that's how you've got great attendances by everyone working together.
Absolutely, and it is everybody working together as well. It's not just the charity pushing people actually, and that is interesting because this year there are 3 areas in the country, or ICBs, ICSs, that have bought into what we're doing, and they're funding them. They're actually funding them.
And it's great that patients don't have to have symptoms to attend. This is a MOT checker.
Right.
You don't need to have symptoms, but have your blood pressure checked. Let's screen you.
So it's like going to ATS rather than the main dealer.
Or Quick Fit.
Yeah, or Quick Fit. Yeah, there are many. What's the phrase? There are many options.
Yeah, other options are available.
all the local garage.
So maybe your challenge to the football teams. I'm a Man United supporter, and you've not mentioned Man United yet so far. But maybe the charge is which club is going to have the healthiest supporters with the best heart health, and what are you doing to help promote that? If Everton are leading the way with it and other clubs are following,
I'd probably say Barcelona actually, because it's got a great food scene. FC Barcelona.
And it depends on which supporters need the testing the most. How much stress they're having during the league campaign at that stage.
At the moment, I know Rajiv and I are a bit overly stressed, but there you go.
We're doing all right.
So are we seeing more risk or just seeing it sooner? Are people prepared for what we're finding? So are people prepared to be told they have high blood pressure? But is the system prepared that we are seeing 35% hypertension detection of the total? So the 10,000 people nearly that we've seen in the last 18 months, 2 years, 35% of those have hypertension. And that this year we'll probably be seeing another 7,000 to 8,000. It starts to become a very convincing discussion around how we offer MOTs, health MOTs to mass population, not mass screening, but mass population offers. But if the Beat Heart Health events are a mirror of society at the moment, what are they showing us, and what should we be doing to do more of it?
I mean, I think that patients and people and communities should absolutely be at the centre of the healthcare that they need, because they're the ones living with the risk or with the conditions. So we need to be led and guided by people and communities. And I think these community heart health events do exactly that. So people willingly come through the door, and their motivations for that may vary, but they come in their hundreds to these events. And they do take ownership. So what we do is tell them what their blood pressure is, or tell them if there's a concern about the heart rhythm. But then that person then accesses their local healthcare and takes it further. And I think, we do need to work in partnership with patients and communities to allow that to happen, because people have, the internet. My patients come in with an idea often of what they want from me, what might be wrong, what they're worried about. And I think we need to take that seriously, and that genuine partnership work in between patients and healthcare needs to happen. And I think the government are recognising this in the sort of 3 shifts in the 10-year health plan. We want to be moving from treatment to prevention, which these events absolutely do. We want to be moving to community rather than hospital, and also to digital rather than analogue, so we can do a live core checks. We get it on our app, don't we, to see if it's AF or not. We can do the point of care NT-proBNP testing there and then at these events. So I think it is a new world. It's an information rich environment, which patients have an idea of what they want and need. And I think we do need to work in partnership with people. And the Know Your Numbers campaign, that's been running for quite a long time. But this concept that people have ownership over their own numbers, my blood pressure is, and I need to know that, and I need to know what that means and what I do or don't need to do about it to keep my heart healthy. Yeah. I think it's a really exciting model as to how we can deliver healthcare in a non-traditional way.
I think the mirror is also to the healthcare system with these events. That these can be delivered and they need to be delivered, because historically as clinicians, we're guilty of sitting in our clinics in hospitals or in GP surgeries waiting for people to come. But with these conditions, which are very common, which are diagnosed late, we have to be more proactive. So it demonstrates to the system at large that these can be delivered in a structured way, and there's a lot of value to people and to the system, because by diagnosing people late, it actually becomes more cost intense to manage these conditions. If we can diagnose them earlier, start treatments earlier, and it can just be lifestyle measures. With high blood pressure, for example, it's not always a pill. It could be being more active, stopping smoking. So simple things go a long way. So it's about turning the system from doubters to believers as well.
Nice. Bit of Jurgen Klopp there, I believe.
Just a little bit.
Sorry, Fozia. What's the simplest thing we should do differently because of what we're seeing?
I think we should be trying to solve problems that exist. And like you've just kind of mentioned, hypertension, when you talk about Know Your Numbers, when you talk about diagnosing hypertension, treating potentially preventable conditions that, if untreated, can lead to heart failure. So diagnosing atrial fibrillation, that's been undiagnosed, treating high blood pressure, because then you can prevent the onset of disease. If you think about it, for many of us, our most valuable asset is our health. And when you lose your health...
health is wealth.
Yeah, health is wealth. It becomes a burden when you've not got health. And I think prevention is perhaps the key thing that we can learn from this chat.
Yeah, I think... I get really frustrated with health messaging. That there was a campaign about, I think it was about 24 from the NHS centrally about blood pressure. And, get your blood pressure checked. I think that was the headline. But the headline for me should have been blood pressure's something like, blood pressure's important and keeping it at the right level. Or get your blood pressure checked, because if your blood pressure is higher, you're more at risk of heart failure. Because people see heart failure and all this is failure and death. And what we're trying to do is a bit of shock and awe and basically sort of, this is serious. And it plays into the hypertension. High blood pressure is the silent killer, because it leads to heart failure, or it potentially leads to heart failure. So I suppose the leave question for the listeners is, if risk is becoming more visible, are we ready to respond, or are we just interested in recording?